So thanks, Paul. Really appreciate the invite. And one good thing about going last is everybody else has got to present all the fun stuff. So what I thought I'd do is really just touch on three things. I'll just give you my thought, given the fact that we've got a whole room full of physician innovators. I'd like to talk about my thoughts on innovation in mitral, in medtech in general, and given the fact that I now work for a non-profit, I have to talk a little bit about us to justify paying for the trip. So look, I think you've seen it and we've heard about this for years. Mitral disease is complex, it's multifactorial. I think it's one of the areas that if we actually realized how tough this was before we started, we may never have started. Yet, we've made a lot of progress, and I think that you've seen that again today. I borrowed this slide, a little portion of these slides from Greg Stone, but you can see a tremendous amount of progress in there. You know, I was going to say culminating with Intrepid, but you know, we're just one of the team. Yet, there's still a lot to learn. And the flip side of that, when you're on my side of the world, if there's a lot to learn, that means there's an opportunity to continue to innovate. We owe you well thought through, well executed clinical studies. And then again, that doesn't always mean randomized controlled trials or sham controlled trials. It means well thought through clinical trials. I think that in all of, the last few years, it's become apparent patient selection, understanding who benefits from repair, who benefits from replacement, is something that we have got a lot to learn about. Here, pre and post-op management, I think that we all had experience in the TAVI side of the world, and going from TAVI to mitral, we thought that would be very simple. They are two distinct populations that need to be treated very differently, both in preparing them for the treatment and then managing them post-op. We've got opportunity to develop ancillary enabling technologies, and I love the imaging work that was presented before. I think that imaging in TMVR is the key to where we're going, and very much looking forward to participating in that. And clearly, a tremendous amount of device system development. From a TMVR perspective, we're really looking forward to moving as quickly as we can into the septal transfemoral, but there is a tremendous amount of activity still going, and I know a lot of startups still working in the space. So jumping just to medtech in general and realizing I have a bit of a captive audience, I want to just talk about a few things that I feel very important, and that is that really understanding the problem you're trying to solve is the first step in any innovation. And you'd see a Stanford bar design textbook, well-characterized need is the DNA of a good invention. And understanding the problem, understanding whether or not there truly is a clinical need that is going to be addressed. And you won't get funding these days unless there's true business potential. One problem I see happening a lot, and this comes from a lot of physician inventors and also from a lot of companies, is not truly understanding what they're doing when they go out to understand what the problem is. And you can see the obvious quote from Henry Ford here. And the point of showing you that is that you need to be out listening for what the physician needs, not what they want. Right? And these programs take time. Where 12, the Intrepid platform, was first thought of in September of 2011, and we are still in the early stages of that therapy, and it's now 2018. So these things take time. There's a lot of work that goes into it that a lot of you may never see. There's years of work that goes in before you end up being public. So as Steve Jobs says here, if we just asked you what you wanted, by the time we've got it, you're going to want something else. Right? So we need to be seeing a step or two ahead. Invention is not innovation. Right? They are two distinctly different things. Invention is but the first step, And I would actually argue it's probably the second step after that needs identification or that understanding of the problem. And Tom Fogerty, who I work for now, made this quote a few years ago, that an idea by itself has no importance whatsoever. It's the implementation of that idea and its acceptance by others that brings benefit to our patients. Right? And this is what takes time. So I'm going to give you the 12 experience. So the first idea, it was probably about a year to come up with the idea, and your normal, your concept that's been written down on the back of a napkin. We have invested, 12 themselves raised $60 million. We had a team of 30 to 40 people, and in the last 3 years after the acquisition by Medtronic, I can tell you that they've spent hundreds of millions of dollars in bringing this forward. So it is a big, big endeavor. When we looked at the problem here, one of the things that we identified was it's not simply about just reducing mitral regurg, right? That's easy. Any sort of valve will do that. The issue in the mitral apparatus was fixation and sealing. And I think that you can see that in the design of the Intrepid technology. You can see that in the design of the Tendyne technology. Just really trying to understand what we're looking for. If we don't have robust, active physician-industry collaboration, we're not going to go anywhere. And I think it works both ways, right? The companies are going to need to get direction and advice and understanding from physicians, but you also need our skills. The team at 12, for example, was probably 15-year experience across the board for everybody involved. Just a lot of technique. I always talked, and this is an argument I had with Paul once, was what we do is also as professional as what you guys do. You wouldn't want me in scrubbing into one of your cases, and vice versa. Running one of these companies is a little more difficult than it may appear on the surface.
Did we argue about that?
Yeah, we did. You thought my job was easy. As I thought you were about to introduce before. Hey, but one thing here, this little slide is trying to show at what time do you go and talk about your idea to a big company, or do you go to a small company? Both innovate, but they innovate differently. Small companies are there looking for disruptive, risky changes. The larger companies are looking more incremental, but what they do have to offer is scale and might, whether that be scale in the order of their engineering or manufacturing and in their marketing. So if you have a technology or an idea, an invention or a thought that is truly different, I would suggest you reach out to folks like me and others that you know in the industry. We are all interested in making this industry successful. So if we can't help you, we'll find some way of getting you to somebody who can. If you've got something that is an incremental improvement over an existing technology, I would be looking at going to the larger companies. You're normally going to be driven to a BD function. I suggest you go straight at the general managers. You're always going to get listened to. I think that becomes important. So I just want to finish up with the Fogerty Institute for Innovation. So this is named after Tom Fogerty, a surgeon that you guys may know of or have heard of at least. He's a remarkable human being. Not only is a great surgeon, he is the probably leading innovator in cardiovascular, in the cardiovascular space. He's a great mentor, and he's got a winery that is also reasonably good. We end up needing to drink a lot of it because we get it for free. But what we do at the Institute, we're a non-profit. We're based in Mountain View on the El Camino Hospital campus, and we do three things. We educate, we incubate, and we elevate. We believe that innovation is both a process and an outcome. It's a discipline that can be both taught and honed. It's best learned by doing through experiential knowledge. Our education program, we work with college folks all the way through to industry, FDA, CMS, and the Patent Office. Incubation, we currently have 10 companies in-house. We have a very rigorous residential program with full contact mentoring. The team has about a 30-year experience on average. Got education, ready access to validated resources. And then what we'd like to do is punch above our weight class here and actually play an increasingly active role in strengthening the entire ecosystem. We want to be able to shape global health policy and regulation through informed advocacy. And I can see I've run over time as well. So just want to thank you all very much.